So things are changing. In 2003, 2004, if we had a new metastatic patient, we would basically sit them down, have a very solemn conversation, tell them that the median survival is approximately 6 to 8 months. At some point we started to say 9 months, then we started to say a year. At this juncture, we don't really have that conversation anymore, because patients who respond to these drugs, particularly nivolumab or lambrolizumab, which is the other drug that we're going to be talking about, these responses may be extremely durable, and there's no way of predicting who's going to respond, or at least at this juncture we don't have the tools to predict who's going to respond and how long they're going to respond for. But what we do know from the phase 1 trial of nivolumab, the median duration of response was 102 weeks, so almost 2 years. And we have patients who've been in response for quite a bit longer than that. We don't know yet if they're going to respond when we retreat them, or how many are going to respond when they're retreated with the same drug. So it's very difficult to predict at this juncture how long people are going to live for, and this has just dramatically changed the landscape of what we do. We have a lot of metastatic melanoma patients working, exercising, living their lives. This wasn't the case years ago when all we had was dacarbazine and interleukin-2.